We're going to see the postpartum disorders. These include the baby blues, major depressive disorder with peripartum onset, or also called peripartum or postpartum depression. And lastly, the psychotic disorder. So, for baby blues is the most subclinical and mildly of these disorders, and the psychotic is the worst of them. In these baby blues, the patient is just a little bit down, don't feel well, is not happy about the baby, and usually they report that they have extremely anxiety about not being a good mother, or feels very tired and doesn't know why is not happy if the baby just born or something like that. But it's quite calm, the situation. The treatment is just supportive therapy. This occurs usually 2 to 3 days after the baby is born, and they present in the office within 2 weeks of the onset. And the treatment is just supportive and close follow-up, because can convert to the postpartum depression. So we need to follow up them, but before the 2 weeks. In major depressive disorder with peripartum onset, this begins 1 to 3 months after the baby is born. Usually in between 1 to 3 months, but could be at least less than a year. That is peripartum onset just being less than a year. The patient presents with severe depression, could be anxiety, mania. Mania could be could be bipolar disorder with peripartum onset, for example. But here the mother is very, very depressed. Is not, for example, the baby is crying and the mother is not paying attention. Here the mother is stressed because the baby is crying and doesn't know what to do. Here the mother is crying and is not paying attention to the baby. This mother is very, very depressed. The treatment is with selective serotonin reuptake inhibitors and cognitive behavioral therapy. Also, we can give some modulation of the GABA A receptors, like brexanolone. The psychotic disorder is the patient has hallucinations, psychotic disturbance, kind of anxiety. Here, most usually the mother has hallucination about the baby, and here there is risk that the mother kills the baby because thinks that the baby is some bad person, and so thinks that needs to kill them or something like that. So here the mother is hallucinating, and this is a danger to the baby because the mother can kill the baby. In major depressive disorder also, but is less. Here I think that is more that the mother is so depressed, and I think that if he kills the baby would be not depressed. But usually here it does not happen. When it is very, very dangerous is if the mother has the psychotic disorder, in which the mother would say that thinks that the baby is some bad person or something, and so tries to kill the baby. So in this situation we need to separate the mother from the baby. If it is necessary, we need to hospitalize the mother in order to separate them. And after the condition is stabilized, the mother can return. We stabilize the condition after hospitalization, giving antipsychotic medications and antidepressant medications. If this does not control the disorder, then we should consider electroconvulsive shock or therapies. If the patient goes with antipsychotic and is right, so now we can return the mother with the baby, but the mother should not be breastfeeding because the antipsychotic medication can pass through the blood. Some cases that I do, others don't, but the point is in front of a psychotic disorder as a postpartum disorder. First step, separate the mother from the baby, then giving antipsychotic medications to the mother. If it's stabilized, then the mother can return, but without breastfeeding. So the baby blues can happen in any childbirth, and major depressive disorder with peripartum onset and psychotic disorder usually appears on the first birth. Here the risk factors for a psychotic disorder is a family history of bipolar disorder or other psychotic disorders. So the most dangerous and for which we need to be very, very concerned is for this psychotic disorder. This is almost subclinical. We don't need to treat it, just follow up in order to prevent conversion to this, and if it converts, to treat it quickly. But this is the dangerous.